ask your questions. But do take the poll. We really want to tailor our discussion to some of these questions as well. So please feel free. So for all those who just joined in, we have a poll going on. It's 5 questions. Do feel free to take it. How are you feeling today? Do you think we can ever return to normal? Do you think wearing a mask might be part of the normal? If you had the opportunity to take the vaccine for COVID-19, would you be willing to? And do you have social gatherings that make you anxious? And feel free to put in the chat section who you are, where you're from, and also take the poll. So my name is Elsa Marie De Silva. I'm the founder and CEO of Red Dot Foundation, but I'm also the Bosch Alumni Network Coordinator for India. And as part of our network activities, we try to host interesting discussions as our members are experts in various fields. And this is our first public event for this year, 2021. And I'm really pleased to have you all. So we have about 66% who've taken the poll. So I really would encourage you to take it because we want to know what you're thinking about so that we can tailor some of the discussion around these questions. And they're very simple. So, okay. So I'm going to end the poll and share the results. So how are you feeling? A lot of you are happy and several of you are curious, but one person is tired and anxious. Many of you are quite optimistic that you think we can return to normal. That's good. Do you think that wearing a mask might be part of the normal? 50% says yes, and 33% says maybe. So obviously we are all anticipating. So this is good because I guess all of us are wearing masks. If you had the opportunity to take the vaccine for COVID-19, would you be willing to? And 67% said yes, that's great. And 25% said maybe. And do social gatherings make you anxious? 58% said, no, I'm fine with meeting people. 33% said, yes, because I am still socially distancing. 25% said yes because of the size of the gatherings. So yeah, so this is very interesting. Thank you for taking the poll. Feel free to introduce yourself. And without further ado, I'm going to start the session. We have with us Miss Marja Einig. She is the Vice Consul General for the German Consulate General Mumbai. Welcome, Ms. Einig. Please, we'd love to hear your thoughts simply because, you know, in India, we went through a very severe lockdown, but in Europe, y'all had the summer, y'all enjoyed the summer, and now suddenly y'all are back into lockdown mode. So we would love to hear, you know, the varying perspectives of you both in Germany and in India. Over to you. You might have to unmute yourself.
Okay, can you hear me?
Yeah.
Okay, great. Elsa, first of all, let me appreciate the efforts of you getting this group together. I was not even aware of the fact that so many Bosch alumni were around. And I'm excited hearing more from you all. What are your special connections to Germany? Where did you study or work in my country? What are the experiences you take along for your life and career? I hope we will soon have the chance of even meeting in person. But for today, I know that Elsa has a very tight program focused at the current situation, everything regarding COVID-19, pandemics, vaccine strategies, etc. And the title you chose, I think, was quite ambitious. You want your panelists to give their views on the question, when can we expect to return to normal? It feels like looking in the crystal ball. And I can assure you that this is the big question also discussed in Germany, more or less every day, daily talk shows, as well as, of course, numerous rounds with Chancellor Merkel and the heads of the Bundesländer, our federal states. In Germany, the pandemic was handled quite well in the first stage. Back in the spring 2020, there was a lockdown which was quite similar to the one you had here. But of course, we were warned by these horrible pictures from some other places like Bergamo, as you all know, in Italy, and had approximately, I'd say, 1 week more to prepare hospitals, intensive care units, doctors and nurses to get ready to fight this virus. So nevertheless, beginning April, as you rightly observed, beginning April, we reached a peak of almost 7,000 cases quite rapidly. But because measures worked relatively well and numbers went down, we were probably a bit too relaxed in the summer, as you just mentioned. Mid-June, we were at approximately 250 cases per day. And after a rather strict period of restrictions of contact, suddenly people were even allowed to travel. Restaurants and shops could open, at least with a restricted number of clients and with hygiene regulations. And one issue discussed even more than I felt in India was the opening of the schools. It became a huge concern to everybody that children might be negatively affected by this, first of all, isolation, but also by the lack of this well-structured teaching, which they couldn't get at home. And another concern, of course, was the parallel pressure on parents working from home and at the same time doing homeschooling for their kids. So Corona clearly showed the weaknesses also in our societies as it did in other societies in many respects. And in comparison to India, the online schooling in Germany posed a bigger problem than here. So digital transformation and capacity building will definitely remain an important lessons learned to tackle in the future. And also looking at the family structures, we are, especially in big cities, very often lacking this typical traditional support of a big family with probably grandparents taking care of children. So even preschool kindergartens were missed dearly, both by kids and parents. Now, in a recent interview, Chancellor Merkel was asked what she would do differently. And she remarked that promotion of masks, even just community masks in the beginning more strongly would have probably been good, because in the beginning there was a lot of reluctance and mixed messages on the value of masks. In particular, because that time there actually was a lack of medical masks, which were supposed to be made available first and foremost to medical staff. The second remark she made, that she should have been probably more adamant in pressing for quicker and stricter lockdown measures in autumn, She was in favor for a quicker reaction, as we had suddenly rising numbers. Beginning November, really all of a sudden, we reached around 14,000 cases per day. But she could that time not yet convince the heads of the federal states, who of course have a lot of responsibilities, how measures are dealt with on the ground. And her warnings and predictions, unfortunately, proved to be right. I mean, she had a lot of scientists, of course, to advise her and the government. And the rise of infections was much more intensive than anybody had foreseen. Like on 22nd December, they reached 36,000, which was an absolutely incredible figure at that time for everybody. So therefore, we are in a lockdown situation again since end of December, which was now prolonged till March. So you see the situation has evolved in a way differently from India, because you were in a cautious mode actually for many months. So right now, you can imagine tourism, of course, is at its lowest, because anyway, you can only book a hotel room if you have very urgent business or other reasons. And with restaurants and cultural institutions closed, there is anyway not much attraction for tourism. And as you can imagine, an immense number of businesses are suffering. So mainly online trading and IT record profits, as you can see, I guess, everywhere. Although government has offered various support schemes, it is still unclear how many insolvencies we will see once we can get the pandemic under control. But up to date, we unfortunately have to record that we had 2.3 million infections in the whole of the period since it started, and over 65,000 deaths to deplore. And as we learn more about the virus, we see that long-term effects are not to be underestimated either. So the way forward clearly is to be more cautious with lifting restrictions too quickly. So this time it will be a step-by-step opening up, which will very carefully be monitored and evaluated depending caseload of infections, which is again closely related to the ability of health authorities to trace the contacts and ICU capacities. So this year's Carnival, a very traditional festival that many of you might know from Cologne, Düsseldorf or Mainz, is cancelled. Usually beer and wine and flows, people love to hug and kiss and sing in the streets, a fantastic chance for the virus to spread. Therefore, no Carnival this year. Our political leaders are, of course, very concerned about the mutations from UK, South Africa, Brazil. This makes the situation quite unpredictable. In the end, it is like everywhere in the world, you have to observe the situation closely and get some good analysis and advice from scientists. Very happy that we have scientists in the round today. So, and a very broad range of them, because virologists are important, but also mathematicians, psychologists, sociologists, because it's a fine balance you have to walk in looking at the virus, but also at the serious side effects on economy, society, mobility, mental well-being. It is a constant learning process. See, for example, now the mutations we see in UK, which actually led to a very, very quick rise of infection numbers. So, I mean, it is clear to everybody that mutations don't stop at borders. That's at the moment one of the problems. Germany is in the middle of Europe and has borders with very many neighboring countries. And many citizens of Europe are, of course, very critical about border closures. They value free travel within Europe and find border closures very counterproductive to this European idea of freedom of movement. Now, frankly, even the question whether the worst is already behind us can hardly be answered easily. Chancellor Merkel pointed out last week that it depends in the end to a large extent on our own behavior. Restriction of contacts and lockdown measures show already encouraging results, but the aim is to get the numbers down to the level where health authorities are able again to track infections and contain the spread in this current situation where they're still a bit overwhelmed by the numbers. There are, of course, positive signs. The situation in hospitals in Germany is slightly relaxed. The worst worries of collapse have not become reality, but the biggest challenge and bottleneck is the man and women power in nurses, medical personnel, doctors. This is a marathon against the virus, and it's extremely exhausting, as we know from here, for the medical personnel. Second positive sign, of course, the vaccination, which promises to be a big game changer. One of the huge successes of science is the enormous speed in developing vaccines. And Germany is, of course, very happy and proud that the research team of BioNTech came out early with the new mRNA technology and managed to do all the scientific steps of testing from phase 1 to 3 in such a short time. And I have to also commend the regulatory authorities. They made a big effort to already parallelly work on their analysis and approval procedures that usually take years. And early on, companies were prepared to take the risk of building up production facilities and even starting production, as we see with Pfizer, or in India, of course, the Serum Institute. Now, vaccination seems to be a race against time and the mutations. EU had followed a common approach in procurement of vaccine to ensure that no EU countries are left behind. And right now we have some frustration in Germany also. Why don't we have enough vaccines in the beginning? Of course, you know, politicians say, you know, we will have, but you know, it just now it's a matter of production capacities, of course, also. We are, of course, happy to see that there are a lot of vaccinations elsewhere, because in the end, it is important to see, I mean, this is a global pandemic, so also if it's you know, getting under control elsewhere, that helps a lot in the global context. While there is a lot of talk, so to say, of nationalistic versus international approaches, again, I think the most encouraging and amazing success stories happen because of fantastic networks of international cooperation, especially in the field of science and research, as well as joint ventures. So very early on, scientists were prepared to share their findings, their analysis with fellow scientists in other countries. This is what scientists are used to do, working in a highly international context, exchanging ideas, inspiring each other. And also the cooperation between research and business, I think, is remarkable, as we could see with BioNTech from Germany and the US company Pfizer, or the Oxford University and the Swedish company AstraZeneca, and now Serum Institute producing millions of doses and of vaccines and exporting them. Probably one more point, just talking about global approach, is one of the high priorities of the German government from the beginning on was the question how to assure a fair and equitable access to vaccines and medicines to all countries worldwide, especially also developing countries, which cannot probably afford to pay huge sums. And therefore we stressed the need of multilateral approaches, especially this ACTA, access to COVID-19 tools, which is coordinated by WHO. Germany already supported this tool quite strongly in 2020, and as far as I've heard, there is some more substantial funds in the pipeline, which will hopefully announced in the next couple of days. So I find looking at parallel discussions in India and Germany or Europe very, very useful. Therefore, we as a consulate, of course, are observing the development in India closely as we had some negative experiences in Germany, relaxing probably a bit too quickly and then experiencing the enormous speed in which suddenly infections spread. We, of course, warn not to lose guard with the opening up of institutions, also public transport, but to continue to be vigilant in crowded places, wear masks, follow hygiene rules, and physical distancing. This virus happens to be invisible and obviously loves social contact with human beings. So only because you don't see this creature, it does not mean it's not there. So thank you so much, Elsa, for inviting me. And I'm very, very interested now hearing the specialist, because this was a very general overview. And now I'm happy to hear the panelists about this. I'm sorry.
Thank you so much, Ms. Einig. You raised so many important points. Just because we can't see it, we can't take it for granted that it's gone away. And even if our numbers are low, it doesn't mean that it has gone away. Take, for example, Melbourne and Auckland. They had to go back into lockdown just before Chinese New Year. And we will go through these unlock and lockdown phases. So some of the things that we have to pay attention to is really make sure that we observe the protocols, the social distancing, the wearing of the mask, the hygiene standards, and so on and so forth. And of course, the vaccination, if possible. So yeah, so thank you so much for your for your thoughts and for sharing the German government's uh, view on the topic and the measures that they've been taking. It's very interesting to see what other countries are doing, and especially your approach to the developing nations as well. So thank you so much. And now I'd like to invite my panelists. The discussion will be moderated by Priti Damle, who is a Bosch Alumni Network member, and she's also a development sector consultant in the public health space. We have Dr. Chandrakant Lahariya, who's a medical doctor, consults with the WHO, is the leading public policy expert on vaccines and health systems. He just wrote a book on Till We Win, India's Fight Against the COVID-19 Pandemic. And we have an epidemiologist, Dr. Arundhati Char. She's the president and co-founder of You Respect Foundation. So over to you, Priti, Chandrakant, and Arundhati.
Good evening to everyone. Thank you, Elsa, for introduction, and thank you, Maria, for setting up that context through Germany and globally. So the year 2020, no one can forget it in their lifetime. COVID moved the entire world. Rather, it stopped the entire world. It was unprecedented, unforeseen. There were thousands of researchers around showing the results exactly opposite to each other, but everything was applicable to COVID. Yes was applicable to COVID, and no was applicable to COVID. So whatever it is, all our discussions always nowadays end into COVID discussions. So in July, August, and September, it was havoc, at least in India. The peak was in the month of August, and then it reduced dramatically after October. Today, we have around 1.35 lakhs of active cases in India. But the good thing is that 4 states and 2 union territories have reported 0 new case in last 48 hours. Deaths are also declined. 18 states and union territories have reported 0 deaths in last 24 hours due to COVID, of course. Nationally, new cases diagnosed per day are in the range of 10 to 12,000. And recovery is almost double as compared to newly diagnosed COVID cases. The best thing is national recovery rate is 97.32%, which is top in the globe. That is one thing we must applaud for Indian government and local governments as well. And the last thing, very important and crucial statistics is that India is the first country to vaccinate almost 8 million of people, its citizens, and also exporting vaccines to other countries. So should we say that we can now breathe a sigh of relief? But then again, we call someone and then Amitabh Bachchan ji say, "Jab tak dawai nahi, tab tak dilai nahi." So no medication, no relaxation. And again, since last week, we are seeing that cases are on the rise, especially in Kerala and in Maharashtra. So what should be the thing ahead, and where are we going? So my first question will be to Dr. Arundhati here. Considering all these numbers and statistics, and Maharashtra again on the top with 3,365 new cases diagnosed yesterday, even ahead of Kerala, having 3,000 newly diagnosed cases. Why are we here where we are today? And what are the lessons learned in last 1 year? And how do you see this in global scenario? Dr. Arundhati. You are muted, you have to unmute yourself.
Sorry, yeah. So thank you for this question. Yes, we are where we are today. We've seen the numbers very well, but all that I can say is we are in a better position today than what we were around mid-September, when we were more than 1 lakh cases per day at an all India level. Today, we've been able to bring it to a little over 10,000 cases per day. So while our caseload percentage remains the same, we've been constantly at 1.3%, 1.4% of active caseloads. In terms of absolute numbers, we are definitely doing much better today than what we were in, say, September 16th, when we had really peaked. So that's the good, that's the good news. So I would say that we can be definitely optimistic about maintaining a tight control here on, more so with the vaccines being rolled out at the moment. But why are we here? We are here because of an interplay of several factors that really brought us to this position of from a 1 lakh to say a 12,000 per day infections. And I would say that it could be a mix of commitment, communication, and methodologies that were used. Um, in terms of commitment, we have to applaud the public health system, the medical fraternity at all levels for coming together and doing what they definitely had to do. And this in turn led to a kind of reciprocal response and responsibility from the population. So there was certain communication that went down to the communities, and I think they listened in very well. That also has played an important role. Now let's take, for example, one particular model that has been cited very often is the Dharavi model. Really, what worked in that little slum community of 2.1 square kilometers, where the density of population is really huge. We have about 1 million people staying in a 2.1 square kilometer. But what was done right over there, and what are the lessons that we can learn from there, for which we are here where we are today? So strict containment measures in 3 primary components. So as I said, effective communication strategy, conducting comprehensive testing. All these, while they ensured that there was uninterrupted supply of goods and essential supplies to the communities. So they had kind of contained that local area such that there was no movement either in or out of that community. And then we had the municipal council, the corporation that came in very responsibly, following the 4T models. The 4T model is generally used in all pandemic situation, which is tracing, tracking, testing, and treating. And they did this very efficiently, and then this was supported by ongoing learning and intervention. So as they learned, they reacted. So even though I would say, even though we were overwhelmed initially at the earlier stages, but we we managed to gain control and have progressed well. For example, somewhere along the lines, when we knew that the cases were rising and only the government health systems were not enough to manage, we brought in the private players. We opened several COVID management centers. We had eventually established a care protocol. And I think the efforts of the medical professionals overall was what really mattered. So that's why I would say we are where we are. If I think we'll come to that question later on, why is Mumbai and Kerala again seeing a surge? But we are in a very comfortable and a positive situation is all I can say at this moment. Thank you.
Thank you, Dr. Arundhati. Yes, the 4 T's and 3 C's were very essential in
Yes.
controlling the scenario in India.
Yeah.
And especially in situations like Dharavi, where it could have been a total demolishment of the locality itself.
Yes,
We
in
could
fact, if they wouldn't have controlled Dharavi, there was a fear that it would
Yes.
rapidly spread, because you see, Mumbai is a very dense, highly dense city. So, yeah.
Yes. So you also mentioned about vaccines, and the next question comes to me, my mind is about vaccines itself. We have been taking vaccines since our birth almost, BCG and MMR and everything. But we also know that developing a vaccine takes years altogether. But this vaccine has been developed in just a small period of a few months. And talking about its safety and efficacy and contraindications and side effects, everybody has different opinions in their minds and dilemma whether they should go for vaccine or they should not. To do or not to do is the question. And we saw that 67% of people in the poll mentioned that they would go for the vaccine. So Covaxin, Covishield, Covid this, Covid that, then Serum, Pfizer, AstraZeneca, Oxford. Everybody has such a great confusion in their minds. What is the scene of vaccines? So my next question is to Dr. Chandrakant Lahariya. Can you shed some light on this vaccine story?
Sure. So thank you very much, Damle and Elsa, for organizing this. Coming directly to vaccines, so vaccine research and development is something a highlight and very good development in this pandemic. What usually could have happened in 10 years, in the last 10 months of pandemic, the world has around 10 vaccines which are licensed or authorized. So this is incredible and really commendable. The research, and especially vaccine research, is the real highlight of this pandemic and given a hope. And that's why, because of availability of these vaccines across the world, that is the reason we are talking today that when can we expect a normal life. If vaccines were not around, the discourse could have been very different. Having said that, there have been a lot of discourse and dialogue. Rather, I can recall from the very early period of pandemic, on 11th March 2020, the pandemic was declared globally. And soon after, people started asking questions that when can we expect a vaccine? And even a very optimistic person around that time, and even I would say that vaccine would take some time, or nobody was thinking that a vaccine would be available before 18 months or 24 months from that time. But today we are standing here and we have 10 vaccines around the world, which shows that power of human beings and the scientific community, that if systems are challenged, human beings are challenged, they can come up with the solutions which really works. And these vaccines, of course, there is a lot of discourse and debate, and some are authorized for emergency use, but there are a few other which are fully licensed. So this is a really important and good development. How this could happen, and there are people who raise that these were rushed, but that is not the case. Many of these vaccines, especially mRNA platform, on this platform, the vaccines have been licensed for the first time. But this is not a platform which is new. Rather, around 25 years ago, the discussion and research on mRNA platform started. It is only scenario that no vaccine could be developed on this platform and we have a vaccine when we need it. So investment done in the science and vaccine research long ago pays off, and that's what mRNA vaccine platform indicate. Similarly, the Oxford AstraZeneca vaccine, this vaccine could be developed in such a short time because the Oxford Research Group was already working on Middle East respiratory syncytial virus, MERS virus, for the similar platform. And when this COVID-19 pandemic happened, because virus comes from the same family, they quickly switched to the COVID-19 virus or SARS-CoV-2, and we could develop a vaccine. So a research which is being done and a trained scientific community, a well-funded research works really well. There were other approaches which followed to expedite the process. One, usually the clinical trials take its own good time, and data safety monitoring board, the regulatory body review the data, and it's a slow process, and one step follow the next step. It's a series of approaches, and that takes its own time, and that's how it should happen in normal times. But in this pandemic period, the regulatory body went out went with a special procedure, so they gave approval for combined phases. When the researcher and manufacturers knew that they have approval, they started enrollment of the people and volunteers well in advance. So time was saved, but there was no process which was expedited. The other final part on the vaccine development, which I would like to highlight, is that there have been many questions and discussions on emergency use authorization, vaccines being given emergency use authorization. So in that, I would argue that we know that COVID-19 pandemic is a health emergency. In a health emergency, we have to adopt and follow a specific procedure which we would not follow in normal circumstances. So most of the countries, including India's regulatory process, has a system which allow for vaccines to be licensed in emergency situation. Though the terminology emergency use authorization has not been used in that sense, but the principles have been laid down and which have been followed. So I'm like really excited and happy, and this is we should give credit to the scientists and public health community and regulatory body that these vaccines are there. One point I would like to highlight, that one of the things which could have been done better in this vaccine licensing and then delivery, I think the communication with the public and communicating how the decisions are being made in a little more transparent manner. Ultimately, vaccines to be administered to human beings who are healthy, and everybody perceive their risk of developing disease very differently. And that setting, we need to have a better communication and transparency. But we should can also think that health expert, regulatory bodies, and even medical doctors are not trained to communicate to general public. So when they face this situation, the communication was not that good. And that's something to be learned for the future. I stop here.
Thank you, Dr. Chandrakant. That was quite in details. And I remember of Noah's Ark. And this is the situation where there is an attack on humanity, and everybody who is in the front line has put us all in the Noah's Ark. That is what I feel. So all the systems coming together and working towards single goal can achieve the things. So that is what we can learn from this. But now, when even Maria mentioned about it, reopening of the schools and educational institutes. So the schools are already opened in phases from 8th to 10th, and then from 5th to 8th. And now even colleges and universities are opening. We are seeing abroad also in Australia and Europe and New Zealand that again they are forcing the lockdown. Even in New Zealand, a 3-member family was found to be positive after traveling back to New Zealand, and entire Auckland was locked down. So when we are thinking of opening of the educational institutes, Dr. Arundhati, what do you think? How will it be the thing, and what will be the challenges put before us? And the second wave, third wave, what will be the scene? Maybe in next few months? Dr. Arundhati, you have to unmute yourself.
Yeah, I keep forgetting. I'm sorry about it. So, one community, unfortunately, that has suffered the most during COVID is our student community. And it has really exposed the education, the weaknesses that still exist in the system, and which we need to work on better. It's also exposed the inequality between the urban and the rural student community. Because of the need to connect online, there have been many students who have actually dropped out of school from rural areas because they have not had the wherewithal to really procure an equipment to connect with their school teaching courses. Now, having said that, opening of schools is something that we will need to closely monitor before we really decide on them. Now, obviously, it is evident that the virus does not emanate from schools. It will be brought in from outside, and therefore a close monitoring of all the stakeholders or people, whether it's students or the senior, the adults and the students who are involved in school education program, will have to be monitored very closely. There have been discussions of staggering classes or of restricting the number of students per class so that they can maintain the masking, the social distancing, and the COVID behavior norms that are expected. But it's really very difficult to say how these will work out. We know of the recent instance from Kerala where they opened up a school and they found, in fact, across two schools, there were more than 400 students who tested positive a month after schools reopened, after which they had to shut it down. So really, what are the measures that schools need to really take before they arrive at this decision of opening the schools? And, that needs to be gauged very carefully. I'll stop. If Chandrakant wants to add anything on this, yeah.
I think, yeah, thanks. This is a fairly comprehensive answer, but I want to highlight the related point.
Yeah.
That the impact of lockdown in high income countries or higher middle income countries very different than the impact of lockdown in the low and middle income countries such as India. And even within the countries, we know the impact of lockdown is far higher and worse on children, women, poor. So we have to really maintain a balance. And of course, this need to be guided by the local epidemiological data. So when we are having this discourse, the discussion in Kerala or some parts of Maharashtra had to be very different than, for example, Delhi or Madhya Pradesh and other states. So that's one. Second part is that something similar which Arundhati ji mentioned, that Oxfam has released a report at early this year, a few weeks ago, and Oxfam has termed this virus as inequality virus because the impact has been worst on the poorest, marginalized women, and unless there is a strong social security system in those countries or those settings, it is not going to help. And a country like India, we have seen that the situation which migrants faced in the country did not arise in any other part of the world. Situation which poor children who do not have access to smartphone or internet cannot go on that approach. So this had to be, a call had to be taken, and it cannot go indefinitely. When local epidemiology allow, and I think state governments are doing a right approach, all that is needed is identifying mechanism to reduce the risk of transmission. But opening school is something which is on horizon and should be done. Over. Thanks.
Yes, that is very essential now, what I see as. Whenever any pandemic thing happens, role of public sector healthcare system is very essential and important. So, of course, considering the numbers we have seen at the beginning of the session, our public health system has definitely done a tremendous job, no doubt about it. And even in the union budget, We saw that it's an increase of 137% on healthcare. That's a really good provision, including 35,000 crores towards vaccination. So that's really a good number. But when it comes to implementation of the prevention, it goes down to the local communities like Pune Municipal Corporation or any municipal corporation and local bodies. But just 2 days ago, I read a report about Pune Municipal Corporation where they have mentioned that out of 151 positions of specialists, only 7 are filled. So the entire Pune municipal population of 60 lakh of people have 7 specialists. And they have 46% of medical officers, or hardly a half of nursing and technicians. So considering this, where both of you see that our public health system is, how robust it is, and has the government or local bodies learned anything and are trying to cover up the things? What are your opinions? The question goes to both of you. I would request Dr. Chandrakant to go first.
Okay, thanks. So there are definitely some of the powerful learnings from this pandemic in different parts of the world. One of the learning is that it's only stronger public healthcare system which does better. And when I say public healthcare system, I mean government systems which deliver both medical care and health preventive and promotive healthcare services. We have seen that a medicalized care system such as United States of America really struggle, because when your focus is on medical services and not enough infrastructure to deliver preventive promotive health services, it does not work, then it will be overwhelmed. So that's a one learning. Second learning is about a stronger primary healthcare system, facilities closer to the people, and third is on preventive promotive healthcare services. So these are the learning which everybody is talking, like Thailand and Vietnam could respond to the pandemic more effectively because over the years, the governments have invested in the primary healthcare system, in public health services, and that's how it is working. Coming more specifically to the answer to question which you raised, like Pune Municipal Corporation, other municipal corporation. In India, this is a very interesting thing, and this is widely known that 74th Constitutional Amendment gave the responsibility of primary care and public health to the urban local body. Now, there is a widespread analysis available that urban local bodies, except a few, are very poor, do not collect enough funds, and they have limited resources. And of the limited resources, they prioritize health at the bottom. And rather, health spending of the most of the urban local bodies in India is less than what they spend on street lighting. And there is analysis available that around 4% of total government spending on health is used by the urban local bodies. On 4% of total spending, their budget is used on health by urban local bodies. This is very less. And then in urban settings, the local body, whatever they spend on medical care, nothing, very limited on primary care. And because health is a responsibility of urban local bodies, the state governments do not invest. And that's why in India, the urban setting had medical care system, but no primary healthcare system. So these are the challenges and which are recognized in this budget. And that's my last point. And before I'll give the mic or floor to Ms. Arundhati. So the final point is that one of the good developments in this union budget is that 15th Finance Commission has given some untied grants to the urban local body. 70,000 crores will be transferred over a period of 5 years to urban local bodies, and this grant need to be spent on urban health services. And there are other provisions and discourse and discussion going on urban primary healthcare services. So if that happens and if this grant is optimally utilized, I really wish and I hope in the next 3 to 5 years, urban primary healthcare and public health infrastructure will be improved. And if whatever difficulties people have faced, if that becomes the outcome of this pandemic, that urban infrastructure is strengthened, that will be a good development. Over.
Thank you. Thank you, Dr. Chandrakant. Now to add on to your discussion points, I would say that for me, we definitely have to strengthen our health systems and emergency response. There is no two ways about it. But I think what we really need to understand is to prepare for both medium and long-term handling of such pandemics in the future. And for this, I think that the way ahead is a data-driven decision-making program. Even you said that, we have to have correct and complete data. Our decisions and our strategies should be informed by data, and that to regular data, which will actually show us the disease distribution and the factors affecting which community for what diseases. Um, I was thinking about the best strategy that we could propose. And I strongly believe that since, again, our health systems are very localized, why not have at the district level? So each district monitors the health of their communities. So have a team, have one epidemiology cell per district hospital with trained epidemiologists who regularly collect data from the area, assess them, and provide this crucial information to the state governments, who could then set up special cells to provide guidance on how districts can really, work towards preventive care or curative care. One more thought that came to my mind was, why not have, like we have the disaster management cell that looks after all disasters of India. Why not have a similar cell at the national level, which would be a national apex body independent of the government, but would have specialists who could then develop strategies for the state and handhold state governments as and when they need. Of course, to top it up, we need a lot of funding for all these bodies and the mechanisms in place. But I think, as we remember, when the 2002 SARS episode happened, epidemiologists had warned governments, of a similar COVID virus, episode in the future. And so it becomes very imperative that at this point, we kind of review and analyze all data globally as well as nationally. And the lessons learned from this data analysis or from this exercise can really drive our strategy, our approaches, our structures that we need to put in place to prevent as well as handle case. So I think the approach now on should be primarily preventive for all future potential epidemics and pandemics. Thank you.
Yes, that's very correct. And even the government is taking up such issues, and in even union budget, they have mentioned not only of strengthening of healthcare infrastructure, but they have mentioned about health and well-being. That is very important for this. Yeah.
Correct.
And coming to the end of this, our topic for today is, when are we going to see the normal? So have we achieved herd immunity, and or this is going to be our normal life henceforth? Quick question to both of you.
Okay, I'll go first.
Yeah.
So have we achieved herd immunity? Very difficult to say as yet, but we know from the serosurveillance surveys that various pockets have been exposed to various levels. For example, we know that the last serosurveillance study that came out of Kerala said that only about 11% of them were seroprevalent. 11% of them have ever been exposed to the virus. So there is a large proportion yet to be exposed. And therefore, so that's one about Kerala. When we talk of Delhi, we know that the latest seroprevalence says that 50 to 60% of Delhi population have been exposed. Yet we are again seeing certain surge over there. But that also may be because of the density of the population in the metros. In Mumbai, on the other hand, you're seeing that 75% of the people may already have developed antibodies. So, which means that there are a larger proportion of people who have already been exposed to or have developed the antibodies, and a relatively smaller proportion of them have yet to be exposed. And therefore, you're seeing that the numbers in Mumbai may not be as high right now. The per day caseloads may not be as high as, say, a Delhi or a Kerala.
if we decide to not to take vaccine and live life with mask, sanitizer, and social distancing, is it okay? This question is goes to Dr. Chandrakant. And the other question from the same person, Ms. Sunanda Zaptiwale, is that if there is shortage of vaccine, why to waste it on senior citizens? Can you answer that, Dr. Chandrakant?
Yeah, so I'll be very brief. The first part is that COVID-19 vaccination in India is voluntary. So if somebody choose to not to get himself or self-vaccinated, that is a choice that person makes. However, for fighting the pandemic, it's important that everybody who is eligible receive vaccine. That's one. Second, while mask, hand washing, and all these are protective interventions, but a person can never say that even if person stays at home and does not go anywhere, how long that can be done, and a person will be coming in touch with other people. So there is a risk. So my advice would be to receive the vaccine, which are safe and effective, however the person makes the choice. Second part is about the vaccination of elderly. I guess these strategies are dependent upon what we want to achieve out of vaccines. So one thing is clear that vaccines are in a short supply. So those need to be prioritized for the time being. And that prioritization, if our purpose in the COVID-19 fight is to reduce the mortality, and maximum mortality is found in an elderly and high-risk age group. So since the purpose of COVID-19 vaccination in a setting like India is reducing mortality, it should be given to elderly population, high risk who can have higher mortality. So that's a right use. However, once more vaccines become available and supply become a little higher, of course, it can be offered to different set of population. But that's the right use, I would say, to use for a high risk.
Please continue. You are not audible. Is there a bug in this meeting?
Arundhati, you'll have to unmute.
No, I think Dr. Chandrakant.
That was for the.
No, I have finished.
Okay. So, Dr. Arundhati, do you want to add anything to that?
Yeah, I just want to say all about equitable, taking care of your population across the age cohorts, and it would be equally important to protect and take care of our elderly as it would be for the working population and the younger adults. Of course, the priority, and I think the vaccines are being rolled out in a very systematic, prioritized manner, where people with comorbidities are going to come much before the healthy elderly also. So in that way, I think the responsibility of the state becomes to take care of all its population, and nobody should be left behind if they so desire it.
Yes.
That's my point.
Yes. That was a very good answer by both of you. And I thank you, Dr. Arundhati and Dr. Chandrakant. And I also thank each participant for their participation and questions asked by them. And I request every one of you to complete the poll so that we can plan our sessions accordingly in future. So thank you very much.
Thank you, Priti, for a well-moderated discussion, and thank you, Arundhati and Chandrakant. I wanted to ask Maria if you had any quick thoughts, since this was your first session with us.
I think it's a very, very good idea to take up such topical issues of the day and discuss them with specialists. So congratulations, and I think there are many unanswered questions, but I think this was an absolutely great start, and I guess the participants might think the same, that they would actually probably have loved to continue the discussion with you. Thank you so much, Elsa. Thank you so much to everyone.
Thank you, everyone. And from the poll, it seems like there is interest in social entrepreneurship gender-related panels, climate emergency, food sustainability, and media freedom. So everything is very interesting, and we definitely have experts amongst our members. So we will certainly, host discussions around these topics. Have a wonderful evening and do keep in touch. Thank you.
Thank you.
Thank you.
Thank you, everybody.
Thank you.
Thank you.
Thank you very much. Bye-bye.
Yes. Bye. Bye. Thanks. Yeah.